Tooth contouring, peg-shaped lateral incisors in orthodontics. The laterals is prepared, etched, rinsed and dry, and a bonding is applied on its surface. Then light cured for 20 seconds. This is tooth number 1-2. A plastic strip is used to separate the treated tooth from the adjacent tooth. And a composite resin was applied to build and contour the surface of the peg lateral. Then cured for 60 seconds. A flowable composite resin is used, and making sure that there is no bubbles present before curing it to set. Filling up the proximal areas first to gain contact to adjacent tooth as well as to gain borders of the width of the tooth. Then, adding a packable light-cured resin to give some bulk on the tooth being contoured. Always place the light on side where the plastic strip is positioned. Trim all the excess composite, extensions, the unnecessary bulk of the resin, and some composite on the gum line with a Fisher burr. Also check the length of tooth being contoured and approximate the width, that it should not be wider than the central incisors. Best to detail out the embrasure with the adjacent central. Check also the proximal outline at the lingual side, the tooth being contoured. Then strip out the surfaces of the contoured tooth to at least minimize roughness of the surface resin. And just to minimize roughness and not thoroughly polished it because of the direct installation of the bracket afterwards. In this procedure, you may or may not use local anesthesia on the area. Although you may see some blood, but it is not painful according to the patient because I did not put anesthesia on this procedure. The treatment was followed immediately on contouring tooth number 2. A plastic strip was used, and increments of flowable resins is being placed and cured. It is important to build the proximal area first. Then the incisal area for the length of tooth. You may also do a spot curing on this procedure so as to set the strip on its best possible position and minimize plastic strip movement that may cause unparallel wall of the contour. Repositioning plastic strips to ensure gumline seal and isolation of tooth from gums to avoid unnecessary moisture. Then adding up resin on the gumline area and curing. After the walls, the bulk of the contour is up, then cured. The lingual side must also be filled up to complete the seal on the tooth for its contour, then cured. Trim the unnecessary resin. Check the gum line, proximal wall, embrasures, lingual proximal wall, length of tooth, labial surface that it should be flat and not rounded. Then strip off some roughness on the tooth contour. Strip polish to swell the adjacent tooth to provide smooth area on the proximal of centrals and canines. Rinse off and prepare tooth for bracket installation. Bond application, then cure. Upon seating, the brackets remove excess cement, then cure. This completes the procedure on contouring peg-shaped laterals. Possible treatment in braces. Especially in cases in orthodontic treatment that there is a present space in the incisor are due to peg-shaped laterals. If you liked my video, please like, share, and subscribe on my channel to see some of the treatments in dental procedure that might be of either entertainment for you and give you an idea for that said treatment. You may also comment below of what you think, like, suggestions, for me to improve things that catches your attention or things that interest you more. Thanks be to God. It's a mismatch, guys.